Welcome to the First Nations Health Managers Association's weekly town hall with your host, Marion Crow, your resource for COVID-19 related news and information. Send us your questions to fnhma@ihtoday.ca. Over the next hour, you'll hear from health professionals and Indigenous community leaders. As always, we have reliable and credible information for you and your community. We want to hear from you.
Tansei, broadcasting from the Nation Talk studio in Toronto, which is the traditional territories of many nations. Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Of course, Toronto is home to many diverse populations, and it is an honor to be on this territory. My name is Marion Crow. I have the privilege of serving as the CEO of the First Nations Health Managers Association. I will share with you that I am from Papa First Nation in Saskatchewan, right outside Regina. So hello, Saskatchewan folks too. I'm so excited to share that that's my home nation. Welcome to another edition, and I was just told this is our 40th episode. How have we done 40 hours of COVID-19 information since last March? But here we are. So thank you so much for welcoming us into your territories, your homes, your nations. It is so appreciated that you find your reliable, your accurate, and of course, the factual information that you need in your nation to protect you, your families, all of our aunties, our cousins. So let's dive in. I do want to share with you that we have two amazing guests today. We are welcoming back Dr. Evan Adams from Indigenous Services Canada, and we also have Isabel Wallace, who is a primary care nurse who has worked those front lines shoulder to shoulder with all of our Indigenous cousins, and I am delighted to take questions at this time as well. So if you have a question, not just for Dr. Adams or Isabel Wallace, but anytime, send us an email, and you can send that to fnhma@ihtoday.ca. I also want to share with you that it's been such a delight working with Indigenous Health Today, ihtoday.ca, and Nation Talk. I really want to thank Jason Acton, Chris Allicock, Stella, thank you so much, girl, for getting us organized, and of course, producing John Barraclough of Peguis First Nation. Now that we have our thank yous done, let's dig in, and I'm calling you in, Dr. Adams Cushion.
Hello, how are you? Nice to see you as always. So there's a lot to talk about this week. I just can't believe how things change. I know that, for many of us, this has been up and down. It's been stressful. There's good news like vaccinations, and then there's bad news like the situation in Ontario or in India. It's all a lot to take in. The same is happening for our cousins across the country. There's a lot happening, and it's a bit of an up and down, and I just want to acknowledge that. I hope that everyone is well. So we're approaching 26,000 cases of COVID ever on reserve in Canada. We're still not good at counting Métis cases, and we're still not good at counting cases off reserve, except in some provinces, with some exceptions. We count Inuit and Indigenous people in the north, like in the territories. They're the majority of the population, so we just count the territorial populations. So that 26,000 count is, again, for on-reserve peoples. The actual count, the actual number of cases is probably higher than that, like at least double. Our number of active cases, so the 26,000 is cases ever since the beginning of the pandemic. Active at the moment, less than 750. We experienced a significant drop since last week. That was surprising because there is a lot of COVID in lots of places, like amongst other Canadians. And we thought that that might affect us really badly, that our third wave, it's actually our fourth wave in Indian country, our wave would take off with the rest of the Canadian population. But we've done fairly well. So we've had a decrease to less than 750 cases from last week, and that's the lowest number of active First Nations COVID cases since late October, well before the biggest wave, which was in early January. We do have variants of concern. We have some ability to count variants of concern on reserve. We have over 500 cases in almost 80 First Nations communities in 5 different provinces. That's concerning to us because you may have heard some of the variants of concern that they're harder on people and they can spread more easily. Some kind of good news. About 2/3 of those are the UK variant, and with the UK variant, the current 4 vaccines that we have in Canada cover for the UK variant very well. We have only 1 recorded South African variant case on reserve, and we have no recorded cases yet of the Brazil variant or the double mutant variant that we're starting to hear about. We are watching the severity of outcomes because we're worried that we're going to see more severe cases amongst the cases that we have. And the good news is that we don't see an increased severity due to the variants of concern compared to the wild type yet. It's still early days. We may see a change. We may see more severe cases, but the number of severe cases from variants is very low at the moment. It's like less than 10 across the whole country in Indian country. We're watching hospitalizations. We're watching the age of who amongst us is being hospitalized because we're concerned. Probably you've been hearing that younger people seem to be being admitted to ICU with more severe disease. So we're looking for that possible signal. And we're concerned, and this is just theoretical, that COVID might be a disease we see in younger populations for a short period. Our focus has been on older people. Older people have been vaccinated. We have lots of policies to protect older people. And what about younger people? Are younger people who tend to be less vaccinated because we've been spending less time vaccinating them, who might be in more social situations than someone who's older and more able to isolate? Are we going to see some changes there? We definitely hope not. We, of course, want to keep younger people safe. And I wonder if younger people are resisting vaccination. We're not sure. In part because the vaccination data might be a little bit slow to arrive, and younger people might have been vaccinated more recently. So maybe we don't quite have a complete picture of how they're doing with vaccinations, but we're hearing stories that they might be a little bit cavalier. They might think, oh, this is a disease for the boomers and not for us young, strong people. Maybe younger people are longer to decide. Maybe it's a peer pressure thing. Maybe it's a generational thing. I don't know, but maybe they're doing just fine. We can talk about that. So we have 136 First Nations communities with cases. That's a lot of communities. That's a lot of us still dealing with COVID, and I wanted to recognize that. My own community had an outbreak after we've had vaccinations. our feeling after vaccination was that things would get better, but they actually got worse, and we had to go into a bit of a lockdown, and we had to set a curfew and be very careful about how people intermingled. So it was a bit discouraging. So I'm acknowledging that for 136 communities, they're probably feeling a little tense, and the number of First Nations communities ever to have a breakout is at close to 450 of us. And that's really quite something. If you think of 450 communities fighting to control infection, that's a lot of work. And I've definitely spoken to some countries like New Zealand and Australia, where they have very low rates of COVID amongst their Indigenous communities. Some good news, though, our recovery rate is 96%. Like 96% of us who've ever been infected have recovered. And that's higher than the 91% for other Canadians. Our hospitalization rate is still fairly low. It's about 59% of us. It's about 59% of other Canadians' rate of hospitalization. And our fatality rate is about 55%, just over half of what it is for other Canadians. That's our fatality rate. So it seems like we're getting more mild disease compared to other Canadians, maybe in part, as I mentioned before, because we seem to be getting affected and infected at younger ages. So the vaccine rollout is continuing on. About 350,000 doses have been delivered to First Nations, Inuit, and territorial communities. That's 350,000. We're pretty proud of that. Thank you to all the workers that have done that amazing work. And for those of you who are still on the fence, there's still time, and we absolutely encourage you to do your part and help protect your villages, and particularly those amongst you who are most vulnerable. And I think we're going to stop there. I'm sure that there are going to be lots of things that we can talk about, but I did want to give a shout out to Isabel, how exciting it is to appear with you. And I hope we get a chance to talk about health careers and about working with the people and service and care, which I think are very traditional duties. Thanks.
Dr. Adams, thank you so much. And it's like you're a very seasoned guest now. You know the drill. Questions are coming. And so if you do have a question for any of the guests, or hey, do you have an amazing health director? All health directors are amazing. Let's just preface with that. But maybe you want to showcase what is happening in your nation about how your nation is combating COVID. Send it to our inbox. We'd be delighted to reach out and hear more collective voices on what's working well for you. What were some of those challenges? And of course, how are we incorporating our traditional practice into the Western care of medication as well? So if you have a suggestion, you have a question, send them to fnhma@ihtoday.ca. And I do want to share, I think all of you know that I am not a broadcasting professional. This is something we've decided to do off the side of our desks at FNHMA, but we're committed. We're committed to you and to getting out the information that you so need right now. And I want to share that, talking about our traditional practices, I don't know if you can see what I'm holding, but it's a piece of braided sweetgrass, and it's just so calming. It's so calming. So just another example of what makes us unique, special, and resilient as we carry our medicines, we lift everybody up, and we're just excited to keep sharing all of this wonderful information. All right, so I do want to do a couple of shout outs. We've got a lot of viewers. I forgot to mention too, there's my untrained media broadcasting coming out, but you are watching this Wednesday, 1 p.m. Eastern on ihtoday.ca. You're watching it on FNHMA, APTN News. And don't forget, you can hear this and watch it again Saturdays, 5 p.m., your local time, on our partner Aboriginal Peoples Television Network. So check out Saturday at 5 on APTN. So delighted to reach an even wider audience in this collaboration. So I want to say, hey Des, thanks for checking us out. Lynn, I see you too. It's not romper room, and so those boomers will get that joke. Michael, I see that you're commenting as well. And of course, more shout outs to Curtis, Gerald, Peggy, John, Edgar, Jean-Guy. I'm so thrilled that you are watching. Christopher, Pamela, Sandra, thank you, thank you. I love seeing everybody tuning in. So I do want to share with everybody that we have another resource at FNHMA as well. So if you have a question regarding COVID-19, looking for information, tools, or resources, we invite you to check out InfoPoint. And now the studio in my ear is cueing that video. And here we are, InfoPoint, a public service announcement from your friends, FNHMA.
Created by your First Nations Health Managers Association, we introduce InfoPoint, a convenient and accessible helpful desk for First Nations health managers looking for credible sources of information on COVID-19. Don't have time to dig? Talk to a real person now at 1-855-446-2719 or email infopoint@fnhma.ca.
Isabel, you can
Indigenous
unmute
Health Today
now.
is another resource of information by region at ihtoday.ca.
Thank you so much for playing that public service announcement from the First Nations Health Managers Association. Kathy Mitchell, she's a member of SAGMUC. She's answering those calls and will be delighted to take that phone call from you or your email. Thank you so much. Now, let's get to our next guest. We are welcoming back, she's been on the town hall once before, but beautiful Bella, Mademoiselle Isabel Wallace. Isabel's a primary care nurse who has been working directly on those front lines. Isabel, come on in, share some stories from the front lines.
Hi, Marian. Thank you so much for having me again. And thank you, Dr. Adams, for all the information. It's always good to be up to date on those statistics. So just to update you, Marian, since the last time we spoke, I was on Inuit territory on our first town hall, the last town hall, but now I'm working back with First Nations communities. And I just want to say hi to my traditional territory, the Wolastoqiyik people. I'm from Madawaska State First Nation in New Brunswick. I haven't been to my home community since November. And knowing that they are in the Maritimes bubble, the Atlantic bubble, I know my family is safe. I know my community is being vaccinated. My family has been vaccinated, so I'm very grateful. So it makes me feel good as a nurse to see that and knowing that at least my family and my friends are safe. And I like to see that also in my patients when I know they are being vaccinated. It's always a good feeling and it's motivating for us. So I have many stories, but I would say that the one thing that I feel like I am so grateful is being able to work in the front line. And that's not something that I expected to do at 28 years old, because I did my master's and I was working in administrative positions. I worked in policy, and all of a sudden, I just had this urge and I was like, okay, no, I need to go back to the bedside. And I went back to the hospital and I got some experience, but always in the back of my mind, I wanted to go back to First Nations communities and Inuit communities. So what I did is I had to recycle all my techniques, right? I did my nursing school and I was good at those techniques. But then 3 years after, I realized, oh my gosh, I don't know how to put an IV anymore. So went back to the hospital, recycled everything, my knowledge, and then I applied and I did some interviews. I failed some, and eventually I got a job in northern Quebec with the Inuit in Nunavik. And I want to say hi to them if anybody is listening. So I was very grateful to be able to serve the Inuit. And while I was in Kuujjuaq, we got the announcement that Montreal was going into a lockdown and this COVID-19 virus was coming in Canada. So it was just unexpected. We always think, oh, it's going to happen somewhere else. It's not going to come here. But then I got the news that it was coming and it was in Montreal. So I decided to stay a little bit longer than expected in my stint in northern Quebec. And it was just a weird timing, right? I started working again in northern communities and then the pandemic started. And I remember just being so stressed about the PPEs and the swabs and like counting the number of swabs we had for the village and looking for our visors and our PPEs. And the communication was not as smooth as it is now between the province and the government, etc. So I stayed for 3 months instead of 1. And then I went back home and I was in shock when I came back down south because everything had changed. And I realized that I had to make so much sacrifices. Like I couldn't go back home, see my family. I needed to protect myself as being a vector, a possible vector for the virus and realizing that I have this responsibility, right? So from that moment on, I decided, okay, no, I'll get through this pandemic and I'll continue to use my skills and my knowledge. And I was trained in an expanded role to work in northern communities, but also I got my certifications like the advanced pediatric advanced life support, the cardiovascular advanced life support, the international trauma life support. So it's been a busy year since we last spoke. And now I transitioned to First Nations communities, and I'm so happy to be able to have a more flexible schedule and have better working conditions. And that's something that nurses, we kind of learned the hard way in this pandemic. So I've been starting to realize that very, very early in my career, but I need to take care of myself to be able to take care of others so I can go through this pandemic and help as many people as possible.
Isabel, describe to me what that looked like, and to all of our listeners who are joining on all of our, our Indigenous radio network. How do you prepare as a nurse and I'm assuming you flew up and did you have to do all of the isolation, and what did you see when you got off that plane? What did that look like? Were people wearing masks? I know you talked about PPE, but share a little bit of what it means to make that great distance, because we know that health services are delivered quite far away from these remote communities. So share a little bit of that experience with us, Isabel, if you don't mind.
I can say that regardless of your employers, being a nurse, you are well prepared, and we have PPEs and we respect the social distancing and the isolation. Sometimes they are mandatory depending on where you live. So I would say that we are very careful. We are respectful of every public health measures that are told for any citizens in Canada, Turtle Island. So, and also because we're First Nations individual, I'm talking about as being an Indigenous nurse, I'm also mindful of the community feeling and also the responsibility. And we don't have the luxury to just go on with our lives as it was if you're living down south and you're traveling up north. So it's like, for me, it is, there are sacrifices to be made, but they are necessary, and I understand the risk. And so it's not that difficult for me to self-isolate from my family and friends. I have to say it has its challenges. It was a real test for mental health. So it's very important for me to be surrounded and talk to my family every day, use FaceTime, the technology that I have. But when I go back in the community and I step, like you said, I disembark the plane and I step on the land, that's when I'm like, okay, this is all worth it. This is exactly where I need to be. So I hold on to that, right? So right now I'm at day 7 out of 14 in self-isolation, but I look forward to putting my scrubs and seeing patients, so that I hold on to that. And then I work for a month and I get so tired and I want to go home, and then I want to go rest and enjoy my time off. So yeah, it's a good balance, I would say. But the feeling that you have, and knowing that you have an impact in this pandemic, I would not see myself doing anything else in a pandemic. And even though it is hard, I feel like I have those skills and this knowledge, and I need to give back to my people. And my community supported me during my education, and my parents and my family, and they are all so proud. And they come back to me and they ask me questions when there are some hesitancy about the vaccine. They're curious. They want to ask questions. Yes, they have their nurse there, but some of the members of my community, they will reach to me, even though I'm on Algonquin territory in Ottawa. They will call me and they don't hesitate to ask me questions. And I do my best to provide the most accurate and factual information for them.
Thank you so much, Isabel. And I just want to say, Joanne, I know you're watching on APTN and sharing your gratitude. Dee Dee Hill is thanking Dr. Evan Adams for information right now as well. And I know everybody, and I'm going to give the cue to the studio in a moment here, but, you know, having on people who serve the front lines in our nations, keeping us safe, we owe a debt of gratitude for your tireless efforts, listening to some of the sacrifices, hearing about, you know, just heart-wrenching stories of what's happening in some nations in Turtle Island. Of course, our hearts all go out to the people of India right now, where we're seeing patients dying outside of hospitals, and the lack of oxygen and other medical supplies. It really is a very familiar cry as Indigenous people. But for right now, we all say thank you. And with that, I will ask Anthony if you will play our thank you public service announcement at this time.
To all the dedicated healthcare workers and providers on our community front lines, we thank you and owe you a debt of gratitude. We stand united as Indigenous health organizations. We support you all in your efforts. For credible information sources on COVID-19, please visit the Public Health Agency of Canada and Indigenous Services Canada websites. The partner organizations mentioned here are also trusted sources to support you. Thank you, and stay safe.
I am so grateful that we have been able to see partnerships form in such an unusual way. We all want to do our best, put our best foot forward for all of you who are keeping us protected. And I am grateful to the other Indigenous-led organizations who joined us in wanting to thank you. And I hope you also have an opportunity to check out the virtual celebration that happened on November 3rd. We were celebrating Certified First Nation Health Managers sharing information on COVID, and you can check that video out on the FNHMA Facebook page, also on ihtoday.ca, where we heard from the Prime Minister, all of the members of Parliament, obviously the leaders of the different parties, Buffy St. Marie, many musical guests. It's 3 hours of gratitude, lifting people up, and just enjoying the moment of gratitude that we all share for everyone keeping us safe. And not just health workers, people who are keeping things clean, all of the custodians, grocery store, pharmacists, the list is long. You know who you are, and I hope you just feel that circle of love lifting you up. Okay, you know what time it is now, folks. We have been 40 episodes. We go to that inbox now. And just a reminder, that email address is fnhma@ihtoday.ca. So, Dr. Adams, are you ready? Why don't you come back on in? I do have some questions for you. You know what, Dr. Adams? Let's just first kick off by, I think people know in Indian country that you are a gifted actor, and you're also a gifted physician. What drove you to the care piece of your career, Dr. Adams? Share a little bit about that decision to enter health services.
I was being all sentimental listening to Isabel. It is really hard to make a commitment to serve the people. In fact, I avoided it for a long time. That's actually why I became an actor, was because I thought it's too hard to get an education and come back and help the people. Because it felt like there was so much to do. And when you're young, do you really want to take care of things, or do you want to have some fun? And I did spend a lot of years being an actor, and it was pretty fun. That's why I did it. It was pretty cool for me. I know for some people it sounds like a nightmare, but for me it was pretty fun. But yeah, definitely it is very Indigenous, very traditional to want to help people. And that can kind of leave you a bit in the midst of your Western training, because the Western training is it's hard, it's expensive, it's strange, because you're going into a work environment that's very unfamiliar. The hospitals are not, environments most of us kind of just hang out in and say, hey, this is a cool, amazing place. It's a tough place. So it definitely has been quite a journey to try and help people, but that was definitely actually part of the reason I became an actor, because I did want to help tell our stories. But then I realized you have to do a bit more. You have to, go back and, get some training and use some of those skills, only to find out that I needed way more than just my skills to work with the people. I actually needed quite an open heart. And I struggle with that all the time, because there's so much need, and I have finite resources, and sometimes I get tired. Definitely I get tired, but it's so nice to be thanked. So thank you for thanking us. It goes a long way. You'll be amazed how often we get told off and not thanked. So a thank you goes a long way. A kindness to me can allow me to be kind back. So I'm feeling the love. Thank you.
We love you, Evan. You know that. You still owe me 20 bingo bucks. I'm just going to throw that out there now. Isabel, why don't you come in and join Dr. Adams as you reflect on entering into a health career? What made you want to do that, and why is it important that our young people consider serving our own nations? Tell us a bit about that, Isabel.
Well, I was pretty young when I started at university. I was 17 and I started in psychology and I did 2 years to realize that the career path was not for me. I wanted to work closely with people and I was involved in research, but that was not good enough for me. So I remembered my community health nurse from when I grew up. My grandparents, they lived right next to our main office and community health centers. So growing up, I was always going to the community health center, speaking to our nurse who was there for 20 years. She was non-Indigenous, but she really made it her practice, and she was well integrated in our community. And when I decided to go into nursing school, I approached my chief and council and I asked them if I could work for a summer with our nurse. So I was very early exposed to community health, and I realized that was my niche, and I wanted to work in a small community. My community was only at the time close to 300 on reserve. So for me, it was very special. I know everybody, I know the families, I know the history. So it makes it more personal. The partnership, I feel like it's not a nurse that tells the patient what to do and giving orders. It's more like a partnership, and I like to be at the same level as my patient. So I had that in my mind, and I decided to go back home and do my nursing degree at the University of Moncton campus of Edmundston, which is the city right next to my community. I was failing my first 2 years. I was on probation at university, and not a lot of people know that. But then I decided to go into nursing. I was rejected at the University of Ottawa, rejected at the Moncton campus, but I was accepted back home. And I was like, okay, I'll go back home. I'll be with my family, my community. And even though my training, there was not a lot of, well, there was none. No partnership was made with my community and the university. There was no internship opportunities for me to go to my community and get credits at the university. So I had to advocate for myself, and I knocked on the Indigenous Services Canada's, back in the day, Health Canada's door to do my final practicum in northern communities. So I went to northern Manitoba. So I did my final practicum, which is at the 4th year of my nursing program. It was a full month, full time, and that's when I realized, oh my goodness, primary care in the northern community is really what I want to do. But then I was accepted to do my master's while I was there, and I was faced with this difficult choice, and I realized, being from a small First Nation community, being the only nurse having a bachelor, only healthcare professional from my community, and I'm the only Francophone First Nation nurse in New Brunswick and also the Maritimes that I know of. Maybe there's one. Please manifest yourself if you're out there. But I was accepted to do my master's, and I was like, okay, I need to keep on going and go as far as I can. So I moved to Ottawa, to this big city that I was not used to, a big culture shock for me. And I wrote a thesis on the integration of Indigenous cultural competency in nursing. So I'm now trying to decolonize nursing. I sit on committees. I'm now working on the curriculum of the University of Ottawa, which is ironic because I was rejected from the beginning. So full circle. And so yeah, that's my nursing journey in a nutshell. There were some challenges. It's not a perfect journey, but it made me who I am as a nurse, and it's never too late to do what you want. I had great mentors, mentors who pushed me to apply to grants and awards that I never thought I would win. my self-confidence was minus 10 because of my probation being a failure in my 2 first years. But then when I was in nursing, I did A and A pluses, and I got the highest mark in the clinical performance and nursing theory. And then I did A plus in my master's. So it's just a takeaway for those young Indigenous folks out there that are thinking about a nursing career or even a medical career. If you think that you don't have the grades, I remember having a 64 in chemistry. It doesn't mean that you cannot do what you really want and what you're passionate about. And I'm always there to support the new ones. If you want to reach out on social media, I'm always available. And I'm also on TikTok now. I want to celebrate Indigenous nurses, and I put some videos. You can find me. It's my handle is norden.nurse. And it's just a fun way to celebrate us.
I love that. I love it. I love it. Isabel, don't go away. I have a couple more questions, and then I'm going to come over to Dr. Adams for some technical questions on COVID. Isabel, tell me a little bit about when you care for one of our loved ones, one of our kinship, and you identify as being from a nation. What do you see in that patient's eyes when they know that you are a First Nation woman?
Yeah, it's different. It's a different feeling. And I remember being in the hospital here in Ottawa. I worked for the Montfort Hospital. And I remember having one First Nation patient, and I recognized her tattoo. And I was like, oh, is that the wampum belt? And her eyes, she looked at me and she's like, how do you know? And I said, well, I'm First Nation. I'm from Madawaska-Malsi First Nation in New Brunswick. And I was setting her IV, and I took the time while doing that to speak about our respective nations. And so we had this, I felt like there was more trust, and she was asking for me when I was working, and I talked to my manager about it, and I said, like if you feel like this person needs care from a First Nation nurse, I'll be happy to have her assigned to me when I'm on. And so that was the first time that I experienced it. And it's not too long ago, because not all of our Indigenous patients, they will self-identify, and for many reasons and understandable reasons. But when I do recognize some hints, and with the names, because I know the region, the names, and I can pick on those things, and then I ask, and that's something that I tell non-Indigenous nurses to don't be shy to ask, don't hesitate. It's always welcome. So when I started in First Nation communities, I was in a community where I will not work, and it's unfortunate because I'm in and out. But I remember some patients, they were talking about their language, and I would make the effort to speak. It was OG Cree, and I would learn some words and body parts, and then I would just tell them, "Oh, I'm First Nation, but I cannot speak my language." And one of the patients started teaching me some OG Cree and showing me videos while I was doing a technique. So it's like, we can talk about everything and nothing while I do certain techniques. I change a dressing. You can talk about the community's event. I feel like it's so important, and it makes them feel more at home, because sometimes it can be scary to go to the nursing station or community health center, and knowing that there's someone who understands the environment and the dynamic in the community, I feel that it's crucial. So even for non-Indigenous nurses, I tell them, just don't hesitate, ask questions, be curious, and really pay respect to the culture and the community.
Isabel, thank you so much for sharing that with all of our viewers, our listeners, people on APTN, both Facebook and the channel on Saturday at 5 p.m. It's so important to hear these stories of resiliency, of sharing our inherent knowledge. And I've told you this before, Isabel, you're one of those folks I know I'll be asking for a job from in 10 years or more. So keep going, keep doing amazing work, and know that you have all of the communities who love you, and your infectious beauty from within just shines. Thank you, Isabel. And you're fun to have a glass of wine with, we found out in Vancouver too. But well, you know the drill. What happens on the road stays on the road. So let's go back to the inbox. Dr. Adams, let's just shift gears here a little bit. And there is somebody who's asking about some of the adverse events after having a vaccination. And I mean, we're even hearing about erect nipples on the side of the injection now as well. Many women who have been on birth control for a number of years worried also about blood clots. What can you tell us, Dr. Adams? And I appreciate science is evolving, and we are now, just starting to get the reporting of adverse events. But what are you hearing about that? And I'll tell you now, the inbox just lit up because I said erect nipples on TV. So it is what it is. We're talking medicine. And I mean, what's worse than a little prick? Come on in, Dr. Adams. Not to say you're one, but we remember the comment from a couple weeks ago. I'm holding my sweet grass.
I'm not surprised anymore. Be related to their vaccination. So things like blood clots or erect nipples happened before there was ever this vaccine. So now we need to figure out, like, are they cause and effect? And that's very important, because we want to minimize some of the negative effects, if we can at all possible, around any of the vaccinations. So we've been hearing about blood clots happening in a very small portion of the population. It's a very rare event where people are having blood clot, thrombocytopenia, or a low clotting factor. And we have been very careful in how we look at that small risk. So, for instance, you're much more likely to get a blood clot from COVID than from the vaccine. So which do you choose? Do you not take the vaccine on this tiny chance, because of that tiny chance you get a blood clot, or do you take a chance and just say, oh well, if I have bad luck, I'll get COVID and maybe get a blood clot, which is way more likely than the other event. It's something that we have to talk about, and for some people, those mild effects, like, oh, I had a headache after my vaccine. For some people, it's discouraging. They don't want to have a headache, and then for others, it's like, well, a small headache compared to being intubated and being in ICU, I'll choose this slight headache. I hope that we can talk about things, because for some people, it does seem like they're attributing some very strong effects to the vaccine. And if I had to say that an erect nipple on the side of your body that you got the vaccine, I don't know what that's related to. I would probably say if it goes away, great. If it persists or get worse, then absolutely you must report it. On the surface, that sounds like a mild effect. It's not the same level as having a blood clot. So yeah, so I'm glad that we're talking about it, and it's really important for audiences to make a decision. Can I live with a headache or an erect nipple post-vaccination? Or am I really nervous about the blood clot for whatever reason? And we should maybe talk about that, because maybe certain people have more of that risk than others. But generally, like if you're a betting person, your chance of having a bad effect is really low. And we know that COVID is bad, or it can be bad. So there's that as well. And I'm afraid that sometimes some people don't see COVID enough. Like some people are still saying, is COVID real? You know, after the declaration of a worldwide pandemic and hundreds of millions of people being vaccinated and, you know, hundreds of thousands of deaths, some people are still saying, really, is there COVID? And that's, to me, a more puzzling question.
You know what, you made such an excellent point, because while we're reporting some minor side effects, maybe having that headache or a bit of a sore arm, I'd much rather have that than be standing outside of a hospital begging for oxygen and being put on a ventilator. And obviously, these are Health Canada approved vaccines, and the minor maybe irritation far outweighs all of the other things, is what I'm hearing you say, Dr. Adams.
And I should say that, blood clots can be very serious, which is why, we're taking a look again at, what are we doing? It's very troubling when there is a serious side effect like a blood clot. And what should we do? It makes it very difficult for us to make decisions. But I can live with the decision at the moment that to tell people there's this tiny risk, and there's, I don't know what in the world doesn't have a little bit of risk. But still, if you're that person who's deeply affected, it's no comfort that 99.9% of everyone else has been safe and you haven't.
I really appreciate you sharing that, Evan, especially when, we joked about a little prick, coming into your arm. While we laugh, because that's what we do, laughter is medicine. We welcome laughter. We welcome that thing that's going to keep us actually coming back to our powwows, all of our beautiful ceremonies when we can gather again. These are things on the pathway to get us back and gathering. So I've done it before. I'll do it again. Wabano Health Clinic in Ottawa. I so love you, and I'm going to steal your hashtag again. Hashtag be great. Vaccinate. It's about protecting you. It's about protecting me, our cookums, our mushums, our nokamas, all of the amazing people in our family and in our nations. So please, if you're on the fence, I think you know where we're leaning towards. So, you know what, Isabel, I do have another comment that I'd like you to chime in on. And Dr. Adams already touched a little bit about some, I would say, reluctance or cavalier, in Dr. Adams' words, in the younger generation. Now, Isabel, being part of the younger generation, a First Nation woman, you are a nurse, you have a large social media following and a lot of respect and clout. What do you tell your friends about becoming vaccinated?
I have to say that I encourage them, and I know that it can be perceived as being slow with the rollout, but at the same time, it is all worth it. And that are messaging me and asking me questions because of hesitancy, of fear. I had some family members that I had to speak and provide some information. and it's non-judgmental. I will always be there to answer and provide the most factual information. Trust what the public health, the government is saying, the guidelines. Follow them. Respect your healthcare professionals and what they say, and trust their expertise. We didn't go through nursing programs and medical programs, and the information that we give is based on that training and that knowledge. And it can be dangerous when you go into social media and you read comments. You have to keep in mind that some are manipulated, some create fake accounts to comment and manipulate the truth. So just be mindful of that, and just reach out to your community health nurses and your health directors for any questions. And also, if NHMA, you're doing amazing work with your portal, and the Wabano Center is doing amazing too in Ottawa.
On that note, last week was Volunteer Appreciation Week, and you said congratulations to FNHMA. I want to take this moment to thank the volunteers of the First Nations Health Managers Association who govern, who guide, and volunteer their time. We're not talking per diem time. They actually just donated on the side of their desks, and those are the health directors and health managers, those people who sit on our board. So thank you, David, Lorraine, Patsy, James, Donna, Darlene, and Addie. I love you all, and I hope you stay safe and healthy. So I can't believe how fast an hour goes, but we are at the end of the hour. I know a lot of questions in the inbox, and don't forget, we'll get to those maybe next week, and keep sending them in. FNHMA at ihtoday.ca. Isabel, Evan, what can I say? Heartfelt gratitude for the work that you do. It's so, the love and appreciation coming in from everybody watching. Some people say, Creator bless you, and I pass those words to you. And with that, I do want to say thank you to all of our partners who help put this show together. Of course, we have media partners, and I do want to say you can check out live on Facebook our partners, and they are Mi'kmaq Maliseet Native News, The Wolf 95.7 in Fredericton, Nation News, FNHMA, Element FM in Toronto and Ottawa, Nishanbek Nation, and Wawate News, NCI FM in Winnipeg, APTN, thank you so much, MBC Radio, what a bad day, Eagle Feather News, Alberta Native News, CFWE, CKLB, Co-op Radio, First Nations Drum, CFNR, great to chat with you earlier this week, and of course, Hashley Tassa, newspaper in Port Albany, BC. Until next time, stay safe, hi.